Have you been taking Amlodipine or Metoprolol for months or even years? If you're over the age of 60, you may have noticed something has changed. You don't have the same energy you once had. Climbing the stairs feels harder. Your afternoon walks seem longer than they used to. Even after a full night's sleep, you still wake up feeling tired. Most people immediately blame aging. They tell themselves, I'm getting older, this is normal. But what if that's not the whole story? What if one of the medications you take every day is playing a role? Now, don't misunderstand this message. Amlodipine and Metoprolol are both proven medications that have helped millions of people control high blood pressure, prevent heart attacks, and protect the heart. For many patients, these medicines are safe, effective, and even life-saving. However, like all medications, they can have side effects. One possible side effect that some people experience is fatigue or low energy. The challenge is that this change often develops slowly. Instead of happening overnight, it builds up over weeks or months, making it easy to mistake for normal aging. In today's video, we're going to compare Amlodipine and Metoprolol and explain how each medication works, why some people may feel more tired while taking them, and what signs you should discuss with your healthcare provider. This video is not about telling you to stop your medication. In fact, stopping blood pressure medicine without medical advice can be dangerous. Our goal is to help you understand your treatment so you can have better conversations with your doctor and make informed decisions together. Stay with me until the end because we'll also discuss who is most likely to experience medication-related fatigue, simple ways to improve your energy, and when tiredness should never be ignored. Welcome to Dr. Bilal, where we turn trusted medical knowledge into simple, practical advice to help you stay healthy, active, and independent after 60. Let's begin with Amlodipine, one of the most commonly prescribed medications for high blood pressure. It belongs to a group of medicines called calcium channel blockers. Its job is to relax and widen your blood vessels, allowing blood to flow more easily and reducing the workload on your heart. For most people, Amlodipine works very well and causes few problems. In fact, many adults take it for years without experiencing any noticeable side effects. However, some people do report feeling more tired than usual, especially during the first few weeks after starting the medication or after their dose has been increased. Why does this happen? One reason is that your body needs time to adjust to lower blood pressure. If your blood pressure drops more than your body is used to, you may temporarily feel less energetic, lightheaded, or slightly weak until your body adapts. Another possible side effect is swelling in the feet and ankles known as peripheral edema. While this swelling itself doesn't directly drain your energy, carrying extra fluid can make walking or standing for long periods feel more uncomfortable and tiring. Some people also notice mild dizziness when standing up quickly. This can make them avoid physical activity, leading to reduced fitness and even lower energy over time. The important thing to remember is that true medication-related fatigue from Amlodipine is not one of the most common side effects, and persistent tiredness may have many other causes. Poor sleep, anemia, thyroid problems, dehydration, depression, or even untreated heart disease can all reduce your energy levels. That's why it's essential not to assume that your medication is automatically to blame. If you've started Amlodipine and your energy has changed significantly, don't stop taking it on your own. Instead, keep a record of your symptoms and discuss them with your healthcare provider. They may check your blood pressure, review your other medications, or look for another medical condition that could be contributing to your fatigue. A small adjustment in treatment may sometimes help, but only after proper medical evaluation. Now let's talk about Metoprolol, a medication that works very differently from Amlodipine. Metoprolol belongs to a group of medicines called beta blockers. Instead of relaxing blood vessels, it mainly works by slowing your heart rate and reducing the force with which your heart pumps. This lowers blood pressure and decreases the heart's workload. It is commonly prescribed for high blood pressure, angina, certain abnormal heart rhythms, heart failure, and after a heart attack. Because Metoprolol slows the heart, some people notice they have less energy, especially during physical activity. You may find that climbing stairs, carrying groceries, or taking your usual walk feels more tiring than it did before starting the medication. This doesn't happen to everyone, but it is a well-recognized side effect. As your heart beats more slowly, your body may take time to adjust, and some people experience fatigue, reduced exercise tolerance, or a general feeling of sluggishness during the first few weeks of treatment. Another change some people notice is that they cannot raise their heart rate as easily during exercise. Before taking Metoprolol, your heart may have responded quickly when you walked uphill or exercised. With a beta blocker, that response is intentionally reduced to protect the heart. While this is often beneficial, it can make workouts feel more challenging. It's also important to understand that fatigue is not always caused by the medication itself. The underlying heart condition being treated, such as heart failure or coronary artery disease, can also make you feel tired. That's why your doctor will consider your overall health, not just the medicine, when evaluating your symptoms. If your fatigue is mild and gradually improves, your body may simply be adapting to the medication. But if your tiredness becomes severe, you experience dizziness, fainting, an unusually slow heartbeat, or you struggle with everyday activities, contact your healthcare provider promptly. Never stop taking Metoprolol suddenly. Doing so can cause your heart rate and blood pressure to rise quickly, increasing the risk of chest pain or other serious heart problems. Any changes to your medication should always be made under medical supervision. Now that we've looked at both medications, you may be wondering which one is more likely to affect your energy. The answer is not as simple as choosing one pill over the other. Every person's body responds differently. While fatigue is generally reported more often with Metoprolol than with Amlodipine, many people take either medication for years without feeling unusually tired. At the same time, some people may notice fatigue for reasons that have nothing to do with their medication. So, who is more likely to experience low energy? Adults over 60 may be more sensitive to changes in blood pressure and heart rate. People who take several medications at the same time may also be more likely to notice side effects. In addition, dehydration, poor sleep, anemia, thyroid disorders, vitamin deficiencies, depression, or untreated heart disease can all make fatigue worse. This is why it's important to look at the whole picture instead of blaming one medication immediately. If you've noticed your energy slowly declining, start by asking yourself a few simple questions. Did the tiredness begin after starting a new medication or increasing the dose? Is it present all day or only after physical activity? Has your sleep changed? Are you eating well and drinking enough water? These details can help your healthcare provider identify the real cause. One of the best things you can do is monitor your blood pressure and heart rate at home, especially if you've recently started treatment. Keep a simple diary of your readings and write down when you feel most tired. This information is often more helpful than trying to remember everything during a doctor's appointment. Most importantly, never stop taking Amlodipine or Metoprolol on your own. Stopping either medication suddenly can increase your risk of uncontrolled high blood pressure, chest pain, or other serious heart problems. If your fatigue is affecting your quality of life, speak with your healthcare provider. They may adjust the dose, recommend taking the medication at a different time of day, review your other prescriptions, or investigate whether another health condition is contributing to your symptoms. Remember, the goal isn't just to lower your blood pressure, it's to help you feel well while protecting your heart. Now let's bring everything together. If you're over 60 and you've been feeling more tired than usual, it's natural to wonder whether your blood pressure medication could be playing a role. Today, we've compared Amlodipine and Metoprolol to help you better understand how these two commonly prescribed medications work and why some people notice changes in their energy levels. The most important message is this: both medications are highly effective and have helped millions of people prevent heart attacks, strokes, and other serious cardiovascular problems. For many patients, the benefits of taking these medicines far outweigh the risk of side effects. However, every person is different. Some people taking Amlodipine may experience mild tiredness, dizziness, or ankle swelling, especially when first starting the medication. Others may never notice any side effects at all. With Metoprolol, fatigue can be more noticeable in some people because the medication slows the heart rate and reduces the heart's workload. While this is often exactly what the heart needs, it can make exercise feel more challenging until the body adjusts. But here's something many people don't realize. Feeling tired doesn't always mean your medication is the cause. Conditions like anemia, thyroid disease, poor sleep, dehydration, sleep apnea, depression, vitamin deficiencies, or even uncontrolled heart disease can all reduce your energy. That's why it's so important to look at your overall health instead of blaming a single pill. If you've noticed a change in your energy after starting a medication, don't ignore it. But don't stop your treatment either. Keep a record of your symptoms, monitor your blood pressure if your doctor has recommended it, and discuss any concerns during your next appointment. Sometimes a simple dose adjustment, a change in timing, or treating another underlying condition can make a significant difference. Remember, your goal is not just to have normal blood pressure numbers. Your goal is to stay active, independent, and enjoy a good quality of life. Thank you for watching Dr. Bilal. If you found today's video helpful, please like this video, subscribe to the channel, and turn on the notification bell so you never miss our latest evidence-based health videos for adults over 50 and 60. Take care of your heart, take care of your health, and remember, the best medicine is knowledge combined with the right medical advice. I'll see you in the next video.